Hello, welcome. Today we are looking at how diabetes affects your mental health. We are still looking at a mental health series. Let's look at some issues about diabetes. Diabetes can be life-threatening if the sugar level is not maintained close to normal level as possible. When the sugar level is not maintained, there could be diabetic complications, such as diabetic ketoacidosis, such as issues with your liver, issues with your kidney, issues with the eye, issues with the limbs. Damages to the eye. Those are some of the things that come with diabetes. Then maintaining the blood sugar close to normal is no mean task. Diabetes never go away. For some people, it could be reversible. But for most other people, it is not reversible. It becomes a pattern, a thing that you live with. And because you live with it, it requires constant adjustment to cope. Sometimes it's a struggle to keep up. You have to check your blood sugar level. You have to take the right medications. You have to take the right amount of insulin, because taking too much insulin could cause your blood the blood sugar level to go too low, and taking too little could cause the blood sugar level to go up. You have to look at what you have to eat and what you have not to eat. And you have to introduce exercise and a lot of other things into your lifestyle, which ordinarily, if you do not have diabetics, you will not have to bother with. It gives you with little or no time to do some other thing. It makes you to be conscious of some of the things you have to do and what you don't have to do. Because when your blood sugar level is low, you are hypoglycemic. That means you're close to getting to coma. And when it is too high, it is also a dangerous thing, because it could lead to some other issues with diabetics. It could lead to diabetic complications, some of them which are also life-threatening. It causes constant stress on the body, because you are constantly stressed, mentally, physically, emotionally, you are stressed. Oh my God, am I doing the right thing? Is the sugar level so high? Is it so low? Is it normal? Is all well with me? And you are stressed because you are wondering, if it's not maintained, will I live long to see my family? Will I live long to see my daughter grow to marry? Will I live long to see my son grow to be somebody? Will I live long to be able to provide for my family? These are kind of the stress diabetes puts on your body. For some people, it's very difficult to accept. The question is, why is it me? Why me? Why me? For some people, it is accompanied with anger, with worry, with resentment, with anxiety. Anger because, why is it me? Why am I the one? Why is it not my neighbor? Worry because, is my sugar level within normalcy that I will not develop diabetic complications? Resentment as so other people are enjoying life, eating what they want to eat, and I have to be the one to eat all these things that are not so sexy, that are not so good for me, that are not so appealing, that I do not want to eat. Anxiety because you are mentally stressed, trying to make sense of all the whole thing that is happening around you. And for some people, there are no emotional support. The other people that is not diabetic do not understand what you pass through. So there is no support. There is lack of both emotional support and psychological support. You are left as if you are all on your own, struggling in a muddy water, trying to come out. But there is good news. Because when you do what you are supposed to do, when you follow what your doctor said you should do, you eat the right meal, you take your medications, you take your insulin, you maintain it, you add a bit of exercise into your daily routine. You see, you are able to consciously make sense out of the whole thing that you could not understand. You could live life with a new zeal. Let us look at some of the mental health issues that diabetes causes. People living with type 1 or type 2 diabetes are at an increased risk of depression and anxiety. Because you are depressed. Why is it so? Today the sugar level is high. Tomorrow is low. Today I took my insulin shots. Instead of the sugar coming down, is it going up? Anxiety and all these things, they affect people living with type 1 or type 2 diabetes. The rate of depression across the lifespan are 2 times greater for people with diabetics than in general population. This is what the research shows. The fear of blood sugar fluctuations can be very, very stressful. Having diabetes can cause diabetic distress, which is similar to normal stress, leading to depression and anxiety. Changes in blood sugar level can cause rapid changes in mood, in emotions, in mental health, causing things such as fatigue, trouble thinking clearly, anxiety. And when you look at all these things, you see that for people living with type 1 or type 2 diabetics, they clearly, if it is not properly managed, they clearly have some of the mental health issues, mostly depression and anxiety. And if these things are not properly managed, it could degenerate to other things. So, for you, for me, for all of us, we need to be on alert. We need to try to find a way to deal with our depression. We must identify with a support group to help us. People with similar issues that we could talk about it, we could share ideas, we could rub minds that could help us. We should be able to do things that will help us lighten our moods, make us to be happy. For some people, listening to music help them. For some people, meeting friends, calling friends. For some people, going to a serene place just to sit and think through issues, it helps. All these things we must incorporate into our lifestyle. And then, of course, exercises helps. Taking 1 or 2, just walking helps. If you can take it, walking. Doing mild exercises that your system can take will really help. Mental health issues is real, especially in a time like this. There are a lot of people that are anxious. There are a lot of people that are depressed. We need to be brothers and sisters keepers to be able to make it. All this to be able to live a healthy life. We will continue this topic next time. If you like our video, kindly subscribe, comment, and like our videos.